Hi friends, in this series of fluid therapy, today I will talk about Isolyte-G. First is the disclaimer. This video is made for educational purpose only. There is no endorsement for any brand or a company. Isolyte-G is a special fluid which is used to replenish the electrolytes and the fluids which is lost due to vomiting or nasogastric aspiration. 1 liter of the Isolyte-G contains 50 gram of glucose, 65 milliequivalent of sodium, 17 milliequivalent of potassium, 150 milliequivalent chloride, and 69 milliequivalent of ammonium. So 100 ml of fluid contains 0.375 grams of sodium chloride, 0.130 grams of potassium chloride, 0.370 grams of ammonium chloride, uh, about 5 grams of glucose, and 0.015 gram of sodium metabisulfite. As we know that during recurrent vomiting or continuous nasogastric aspiration, there is a tremendous loss of electrolytes like sodium, potassium, chloride in the gastric juices. So this leads to hypokalemic metabolic alkalosis. And this Isolyte G is a gastric replacement solution. It provides all the electrolytes which are lost by the gastric juices. So it corrects the alkalosis and provides the calories. Isolyte G corrects the electrolyte imbalances which are caused by the losses of the gastric juices. So it corrects the hypochloremia, hypokalemia, and it also corrects the metabolic alkalosis. The ammonium ions which are present in Isolyte G, they are converted into urea and hydrogen ion by the liver. So hydrogen ion produced will replace the deficit of hydrogen ion caused by the loss of gastric juices, and hence it corrects the alkalosis. So in short we can say Isolyte G is a unique IV fluid that effectively corrects the metabolic alkalosis and replaces the essential electrolytes. Indications for the use of Isolyte G are: it is used to replace the fluid lost due to persistent vomiting or gastric aspiration, and it is also used to treat the metabolic alkalosis which is caused by the excessive administration of the sodium bicarbonate or the diuretic therapy. Various contraindication for its use or the condition where we should avoid Isolate G or the severe hepatic failure, because in liver failure it will further worsen the liver failure, because uh, the ammonium ions in the Isolite G, they will not be converted to hydrogen ion when there is hepatic failure. So accumulation of such unchanged ammonium ions may precipitate the hepatic precoma in severe liver disease. Moreover, this process of conversion of ammonium ions into hydrogen ion will be an additional load to the already sick liver cells. We should also not use Isolite G in patients with renal failure, because it can increase the risk of further acidosis and potassium levels. Isolite G, they may aggravate uremic acidosis due to addition of hydrogen ion and may lead to hyperkalemia in renal failure patients, because it contains about 17 milliequivalent of potassium. So in patients with renal failure, Isolite G should be avoided, or it should be used very judiciously. Patients with metabolic acidosis, we should avoid, because it provides the hydrogen ion and it will further aggravate the metabolic acidosis. Patients with severe vomiting with shock, Isolate G is contraindicated for the initial therapy of the shock due to vomiting, because it carries the risk of hyperkalemia due to its high potassium concentration and poor ability to raise the blood pressure due to comparatively low sodium concentration. This is all about Isolite G. Mark Twain has said, "The only way to stay healthy is not to eat what you don't want, drink what you don't like, and do what you rather not." Thank you. I hope you like this video. Thank you very much.